I am Sally McManus. I've been working with the National Centre for Social Research since 1999, and for many of those years I've worked on the National Study of Health and Wellbeing, which is really one of the most important surveys that we do at the National Centre. It's a survey that was first carried out back in 1993 and then was repeated in 2000, again in 2007, then in 2014, and now we have got the opportunity to run that survey again. So using very similar methods each time, asking about many different aspects of health, well-being, health behaviours, and the different sorts of stresses and strains that people face in their life. It makes it an incredibly powerful and long survey series. So what we do is we pick a random sample of addresses, and then we go to those addresses and we find out who lives there. Our specially trained interviewers visit these selected addresses and carry out a 90-minute interview in the participant's own home at a time that suits them. The interview covers questions on health and well-being and the stresses and strains of everyday life. And it's entirely voluntary, so it's not mandatory to take part, but we really hope as many people will as can. A whole range of different researchers can then apply to make use of that data. The data is held very securely, and they're only allowed access to it if that data can be used to benefit people and patients and highlight inequalities and address differences and improve services. Those are very much the reasons for which the data can be used.
So I'm Jade Asmunchi. I'm a researcher and a clinician. I'm based at the Institute of Psychiatry, Psychology and Neuroscience at King's College London. In terms of my job, I research to try and understand mental health and well-being in populations. In addition to the National Health and Wellbeing study, there's going to be an additional study that really focuses in on the mental health and well-being of minority ethnic groups. And it's very timely and needed because the last equivalent study was done almost 22 years ago. And this is problematic because unless we do studies like the one that's being planned, it's very difficult to understand the mental health needs of ethnic minority groups. It's very timely because we've known for some time that minority ethnic groups experience disproportionately poor outcomes in mental health services. And so what the boosted survey will do is it will allow us to get a proper view of the population at a national level to really try and understand people's mental health needs. And then that will then help to inform how we might think about providing services or interventions to help people in the future.
My name is Danielle Oom, and I'm chair of the Integrated Care System for Coventry and Warwickshire. I also am part of the Committee for Health Watch England, which is really about championing the voice of patients and the public in health and care. It's really important to collect data on the health and well-being of everybody in the country because, obviously health and people's well-being is vitally important because it affects how you live your life, and also we need to be able to provide the right services to support people when they need them. And if you don't have that data, you can't be sure that the services you provide are the right services, or that everybody's actually receiving them, and that when they do receive them, they're doing the job that they're meant to be doing. It's really important for all of us to take part in the study. If we get the opportunity to take part, even though it can feel uncomfortable answering questions, and we do tend to feel distrustful as Black, Asian and minority communities about people asking us questions. If we don't take part, then that information will not be there, and it will not be possible to be really clear that we're targeting resources where they need them. So I would really encourage people to get over any feelings of, I don't want to share my information, and really think about, for the greater good, it's important to share that data. And certainly if I get the chance, I will be participating myself.